This training module addresses the critical need for clarity in clinical communication. A 2023 study revealed that the public has a very low understanding of common medical acronyms, with most terms being incomprehensible to the majority of adults. This module aims to define key medical abbreviations and reinforce the importance of translating this terminology into plain language. The objective is to ensure all healthcare professionals can navigate clinical documentation efficiently while also communicating with patients effectively and safely. By mastering these terms, you improve internal coordination, but you must also learn when to set them aside. The goal is to bridge the gap between professional jargon and patient understanding to ensure safety. First, we will examine abbreviations used in clinical charting and diagnosis. RO stands for rule out, a term used to indicate a potential diagnosis that is being investigated and needs to be systematically disproven. It is a vital part of the diagnostic process, signaling to the team that further testing is required to confirm or exclude a condition. SOB denotes shortness of breath, a critical symptom requiring immediate assessment and monitoring. Additionally, VSS, or vital signs stable, is a common notation confirming that a patient's core metrics, such as heart rate, blood pressure, and temperature, are within a normal, non-alarming range. These shorthand notes allow for quick status updates during shift changes. Next, we will decode laboratory reports, which are often dense with abbreviations. AU is a urinalysis, an analysis of urine often used to diagnose a UTI, or urinary tract infection. Understanding these acronyms is essential for interpreting lab results quickly and initiating the correct treatment protocols for patients presenting with common infections. Comprehensive testing is often done via a blood panel. The complete blood count, or CBC, analyzes three main cell types. First are WBCs, or white blood cells, which can indicate infection when elevated. Second are RBCs, or red blood cells, which carry oxygen throughout the body. Finally, platelets are measured, which are essential for blood clotting. The CBC is further detailed by specific tests like H-Court or hematocrit, which measures the proportion of blood made of red blood cells. Another key metric is HGB, or hemoglobin, the specific protein within red blood cells that transports oxygen. These values are critical for diagnosing conditions like anemia or assessing a patient's hydration status. A comprehensive metabolic panel, or CMP, assesses overall organ function. It measures ALT, or alanine aminotransferase, to screen for potential liver damage. It also tracks BUN, which is blood urea nitrogen, and creatinine levels to evaluate kidney function. Monitoring these chemical balances helps clinicians understand how a patient's internal systems are processing medications and waste. Finally, a lipid panel measures various fats in the bloodstream. This includes LDL, or low-density lipoprotein, often referred to as the bad cholesterol because it is linked to heart disease. Conversely, HDL, or high-density lipoprotein, is known as the good cholesterol. Balancing these levels is a key part of managing long-term cardiovascular health and patient wellness. We will now review medication administration and dosing instructions. The route of administration is specified by precise terms. PO stands for per ors, meaning the medication is taken by mouth. SQ, or SC, stands for subcutaneous, which refers to an injection given under the skin. These distinctions are vital to ensure the medication is absorbed correctly. Other common routes include IM, or intramuscular, which is an injection directly into a muscle, and IV, or intravenous, where the medication is injected into a vein for rapid effect. Precision in the administration route is crucial for therapeutic success, as different routes change how quickly a drug enters the bloodstream and takes effect. Dosing frequency is often indicated with Latin-derived terms that must be followed strictly. BID means twice a day, TID means 3 times a day, and QID means 4 times a day. Misinterpreting these timing instructions can lead to dangerous medication errors, making it essential for every member of the healthcare team to be fluent in these codes. In summary, proficiency with medical abbreviations is fundamental for interpreting clinical charts, lab results, and medication orders. This specialized vocabulary enables efficient communication between healthcare professionals. However, the key takeaway is the dual responsibility to understand this language for professional practice while consciously avoiding it in patient interactions to ensure they understand their care. As research confirms, using these terms with patients creates significant barriers to understanding. The ultimate goal of this training is to help you translate complex medical information into clear, accessible language. By doing so, you promote patient safety, adherence to treatment plans, and overall health literacy, leading to better outcomes for everyone involved in the clinical process.